Hi viewers, good afternoon. I am Dr. I.V. Reddy, Consultant Orthopedic Surgeon and Head of the Department of Orthopedics at KIMS Hospital, Minister Road, Secunderabad. Today, 4th August, is Bone and Joint Day. So, on the occasion of this Bone and Joint Day, let us learn few things about bones and joints, how they function, how to keep the bones healthy and strong, and what sort of diet we have to take to keep them healthy, and also the required vitamins, minerals and such things. Let us start with the functions of the bones. Bones have definite function to perform in each individual. As we all know, bones form joints. When two bones ends join together, a joint will be formed. Say for example, knee joint, hip joint. So for the formation as well as functioning of the joints, bones are very important. Healthy bones are very important. They should be strong, they should be healthy, and then only our joints will be there, and because of which locomotion, the mobility is possible. And I must say, mobility is life. Without mobility, there is no meaning for life. That's why bones are very, very important, and we have to keep them healthy also. We will discuss about how to keep the healthy at a later stage. Coming to the other functions of the bones, they protect, the skull, for example, skull bones, they protect the important organ of the body, vital organ, brain. Similarly, thoracic case, we call this as thoracic case, it protects the important vital organs, heart and lungs. Similarly, pelvic girdle is there, which protects some of the organs there, like urinary bladder, and in case of females, the uterus, ovary and other structures. And apart from this, the protective function, bones also are very important for certain other functions. For example, red blood cells are formed in the bones, bone marrow. So this is very important. If we have to maintain our blood levels, bone marrow functioning is very important. Similarly, bones act as a storage function also is there for calcium and other minerals also. Calcium is very vital for certain functions in the body. For example, blood clotting. Without calcium, blood will not clot. So this calcium constantly will be circulating in the blood. If there is any deficiency in the blood, it will be drawn from the stores, calcium stores, which are the bones. Similarly, calcium is very important for some biochemical reactions in our tissues. Calcium is also needed for muscle contraction. If you take all these things again, you will realize the importance of the bones. Unless you have healthy bones, you will not be able to perform a lot of functions like this. So coming to the development of the bones, how the bones develop. We all talk about growing of the individuals. We built up height. As a child, if you imagine, when the child becomes an adult, he will have added height to his body. So how this happens? This is because of the increase in the length of the bones. In the limbs, for example, if you take lower limb, you have the femur in the thigh, you have the tibia and fibula in the leg. Similarly, of course, in the upper limb we have here humerus and ulnar radius. So all these bones keep growing up to certain age. Because of this, we increase our height. For example, if you take as these bones, as I said, the thigh bone, leg bones, they are called long bones. You have short bones also, like the vertebral bodies. So you have spine as well as the long bones of the limbs, which will increase your height as one grows from the childhood into adulthood. So normally this increase in growth happens up to certain age. In case of males, usually this happens up to the age of 18. In case of females, 16. After that age, there won't be any further increase in height, any individual. So this has to be understood. After the age of 16 in females and after the age of 18 in males, there is no further increase in height. Some people claim that they will, by their medication or their programs, they will increase the height. This is all cheating. So don't believe in all those things. After the age of 16 in ladies, after the age of 18 in males, there won't be any further increase in the height. Only thing is, you can increase the strength of the bones, you can increase the girth of the bones, increase the density of the bones, increase the strength of the bones after that age also, but you can never add length to the bones. So you don't grow further after that. So how this happens? A child, for example, if you take at the age of say 1 or 2 years he will be very short, and an adult will grow up to say 5'8" or up to 6 feet also. How this happens? This happens because of the growth centers that are there in the long bones. For example, as I said, femur. You have a growth center at the upper end as well as the lower end. These are called growth cartilages. These growth cartilages slowly go on adding bone, thereby increasing the length of the bone. And this increase in the bones, long bones, will ultimately reflect in the height of the individual. If you take, for example, the height of a particular individual, it is determined by two important factors. One is genetic factors, the other is environmental factors. Genetic factor cannot be changed. There is nothing that we can do because it is dictated by the genes, whereas environmental factors can be manipulated to get the best out of it. Say, let us say, for example, in particular family, all people will be growing very tall. In certain families, they will be short. This is because of the genes. Genes dictate how much an individual will grow. If you take, for example, a particular person who is by genes is destined to become 6 feet in height, will regain that 6 feet, will be able to grow to 6 feet only when the environmental factors are favorable. If the environmental factors are not favorable, he will not be able to reach that height which is determined by the genes. So, primarily the genes must be carrying that information, and which will ultimately dictate the height of the individual. Beyond that, it cannot happen. So, as I said, if somebody is destined to become 6 feet, that person should take care in certain aspects to achieve that particular height. Say, for example, these environmental factors. Let us discuss about these environmental factors which are very important for the growth of the bone. Most important of all this is the balanced diet. Diet is very important. Regularly balanced diet is needed for the growth of the bones. So, in the diet, the most important things are the protein. A regular supply of protein is needed. Normally, we say about 1 gram of protein per day per kg body weight. If somebody is, say, for example, 70 kilos, he need to take at least 70 grams of protein per day. That is the protein requirement of the body. Similarly, one need to have regular supplies of calcium, vitamin D for the growth of the bones. And in our terms, we say about 1 gram of calcium is required for each and every individual, irrespective of the age of the person. From childhood to elderly, everybody need to take at least 1 gram of calcium. And this can be through the diet. If the diet doesn't supply, then one has to take supplements. We'll talk about that in a minute. So that is about the requirement of the calcium. Similarly, vitamin D is required. Where from vitamin D comes? Most of the diets will not have vitamin D. But one good thing about this is we can manufacture our own vitamin D in the body, provided we expose ourselves to sun rays. Sun rays will have ultraviolet rays. When these ultraviolet rays hit our body, under the skin there is what is called cholesterol, a form of fat. From the cholesterol, vitamin D is manufactured. So, if you expose yourself every day, at least for half an hour in good sun, you will be able to manufacture the vitamin D, which is very, very important for the growth, development and health of the bones. Not only for the bones, vitamin D is very, very important for several other reasons. Research has shown that good vitamin D intake on a regular basis will prevent certain cancers also. That's why if you see nowadays, if you have gone to doctors, most of the doctors, they will prescribe vitamin D on a regular basis because it is not that expensive and it can be taken once in a week or something like that. That people who have visited the doctors, a physician or an orthopedic surgeon might be knowing about this one. So you can manufacture your own vitamin D provided you expose yourself to sun. If that is not possible for any reason, particularly this happens for all the people who live in cities, because we don't have the opportunity to get into the sun. Majority of the times we will be indoors, sitting in the AC rooms, and always, most of the times, never go into the sun. Because of this, all of us will end up with deficiency of vitamin D, because no other dietary source supplies vitamin D. That's why you have to depend on supplements. And it's not a difficult thing to take the supplements. As I said, once a week tablet is good enough for 6 to 8 weeks. After that, for maintenance, once in a month, vitamin D tablet will take care of the needs of the body. So apart from that, you need other minerals also, like phosphorus, magnesium and other things in smaller quantities, but most important is calcium and of course phosphorus. Calcium and phosphorus together are called calcium phosphate, which is also known as hydroxyapatite, one of the important component of the bone. So when this calcium content comes down in the bone becomes weak. That's what we call in our medical terms osteoporosis. We'll talk about that again at a later stage. So this is as far as the adding length of the individual is concerned. The bones will grow because of the growing ends, that is growth cartilage. This growth cartilage can be identified on the X-ray. If a child is subjected to an X-ray of any of these parts, you can see those growing parts. Those are what we call growth cartilage. That will be seen as a gap in the bone at either end. Easy to see. If this growth cartilage disappears, that means there is no further adding of the growth. This happens, as I already said, around 16 to 18 years. After that, you can't see any growth cartilage on the X-rays. That means in adults X-rays, you will not be able to see those gaps. So that is about gaining height. So we have to have that genetic basis, which is not in our hands. It runs in families. But what we can do is taking care of the environmental factors. If the environmental factors are manipulated in a favorable way, we can achieve whatever the genes have determined us to become. It could be 5.6, it could be 6 feet or whatever. So that is about the height of the individual and the height of the length of the bones. Now coming to the strength of the bones. As I said, after that age also, 16 or 18 years, you can go on adding strength to the bones. There is no limit, age-related limit is not there. You can go on increasing the strength of the bones. So this is again by following certain measures. I will tell what they are. Most important of all this is a regular exercise, physical activity. Very important. All of you must be knowing that people go to gyms to build up their muscles. But they don't understand what happens to the bones. Just as the muscles are built up with exercise, bones also will get stronger with exercise. But only we concentrate on the muscles, but forgetting about the bones. Healthy bones, exercise is very important. Physical activity is very important. Any form, physical activity in any form definitely will increase the strength of the bones. So in children, for example, we take regular games and sports. Open door activity is very important. Nowadays, unfortunately, many schools will not have the playgrounds. They are not able to participate in games and sports. And also because of all these gadgets, computers and other things, majority of the children nowadays are confined indoors without any physical activity, which is not at all good for the health of the bones. So one has to look into this aspect. Physical activity in children is very, very important. Encourage children to have some amount of physical activity. It could be in the form of, as I said, games, sports, running, this, that. At least some sort of mobility is very important for them. So apart from physical activity for healthy bones, as I already said, in the case of growth of the bones, even for the strength of the bones also, a balanced diet is very important, which supplies regular amounts of vitamins, minerals, protein. So a regular diet also is very important for the strength of the bones. And I must say here at this juncture, two important things. The habit formations, alcohol and smoking. Smoking is one of the bad things for the bones, I must say. If somebody smokes regularly, their bones will not be healthy, will not be strong. So one good thing I have observed in the recent times is a lot of youth, they are not smoking, I must say honestly. If I remember my high school days, everybody used to smoke. Now the smoking habit has come down. That is a good thing that is happening in the society. But alcoholism is there. Too much of alcohol also is not good for the health of the bones. Once in a while is okay, but on a regular basis, if somebody consumes, particularly at a young age, it is not at all good for the health of the bones, I must say. These two important things, smoking and alcohol, particularly in young individuals, is not at all good. So we have to educate, counsel our, in our community or in our own families, children, to not to go to those areas. That's very important. So I talked about the balanced diet, I talked about the smoking, alcohol influence, and also the physical activity. These are all very important. Apart from that, you must have heard of some chronic diseases affecting some individuals, not all, some individuals. Any chronic disease in the body, particularly affecting the functions of the vital organs like liver, kidney, they also can lead to weakness of the bones, what we call osteoporosis. whenever there is a disease process, chronic disease process in the body, because of which the bones become weak, that particular condition is called secondary osteoporosis. Osteoporosis means brittle bones. Brittle bones. We call them as osteoporosis. So, talking a little bit about osteoporosis, brittle bones, usually we see this as a physiological phenomena in elderly individuals. In the case of females, around 65 years. In the case of males, it is about 70 years. Osteoporosis is quite common. That is a physiological phenomenon. Because of the osteoporosis, the bones will become weak. But that means the density of the bone comes down. It becomes very porotic and brittle. A small fall is enough to fracture the bones. And that is why we see quite often elderly people coming with hip fractures, spine fractures, and sometimes even the wrist fracture. These are the common areas where weak bones get fractured because of minor injuries. So this is a physiological phenomenon. Apart from this, in females, I must say, menopause, around the age of 45 or so, they attain menopause. And in menopause means the ovaries start functioning. Normally they produce a hormone called estrogen, which is very important for the strength of the bones in females particularly. So once the estrogen is withdrawn from the systems, the bones are likely to become osteoporotic. Before we go further on this subject, I must say there is what is called a peak bone mass. This is very important. Try to understand this, please. Peak bone mass for every individual. Peak bone mass means the maximum amount of bone accumulated in the body. This happens around the age of 30 for every individual, I must say, irrespective of the sex or whatever, the cultural backgrounds or whatever. Around 30 years of age, we attain maximum bone mass in the body. That is what is called peak bone mass. So if we aim for the maximum bone mass around that age, we will be protected for the rest of the life. So we have to attain this maximum bone mass by that age. That's why, as I said, children and young adults, college goers, high school students must be encouraged to have physical activity. Without physical activity, they will not be able to accumulate this maximum bone by the age of 30. So physical activity must be encouraged, and they must be provided with balanced diet, supplying all sorts of requirements that I have already mentioned, and also they must not be allowed to get habituated to smoking and alcohol. This is very, very important. Then only they will be able to achieve that peak bone mass. Once you achieve that peak bone mass by the age of 30, as I said, after that the bone mass will not increase. In fact, it starts decreasing. That is common for every individuals. Whatever amount of bone mass you have accumulated by that age, it is bound to decrease gradually, very gradually. I must say at the rate of 0.5% per year. The bone mass you are going to lose. Every year you are going to lose 0.5% of whatever you have accumulated by that age. This goes on until we are alive. 0.5 at the rate of 0.5% you will be losing. So if you imagine, say for example 20 years, I said 30 is the age for peak bone mass. If you imagine 50 or 60, how much of bone you are going to lose from the skeleton. That makes your bones weaker. If you have not accumulated the maximum bone at that time, by the age you reach 60 or 65, your bones are likely to become weaker, osteoporotic. And particularly in females after the menopause, this loss of bone is not just 0.5%. It could be 2 to 3% because of the withdrawal of the hormones, estrogen. They lose more bone than males. So any female who attains menopause will start losing the bone from that time up to 3% in a year. It is not just 0. The males will be 0.5%. In a female after menopause, it could be up to 3%. This goes on for the next 10 years. Say, let us say a female attains menopause around 45. This accelerated loss of bone goes on for a period of 10 years. That means up to 55 years. After that, the loss again comes down. It becomes 0.5% as in the case of females. But during this 10 years period, she might have lost quite a good amount of bone from her skeleton. That's why females suffer from these brittle bones more often than the males, and also at a younger age. As I already pointed out, females could become osteoporotic around the age of 65, whereas in the case of males, this menopausal thing is not there in case of males, so there won't be accelerated loss of bone in the males, so they don't become osteoporotic until the age of say 70, 75. So that is the difference between the males and females. So coming to the osteoporosis subject itself, osteoporosis can be divided into primary and secondary osteoporosis. Secondary means because of some other disease in the body. As I already said, diseases of the kidneys, disease of the liver, or the metabolic disorders, what we call, they can produce secondary osteoporosis. Similarly, some hormonal imbalances, thyroid function, if somebody has excessive thyroid function or pituitary gland function, they can also lose more amount of bone from more amount of mineral from the skeleton and become osteoporotic. And people on some special medications for some other reason. See, sometimes we may have to take, even though they are not good for our certain parts of the body, sometimes for important reason we may have to take. For example, you must have heard of steroids. Steroids are not good for so many reasons, but sometimes in certain diseases to control, doctors have to put the patients on steroids. For example, you must have heard of say transplants like kidney transplant, liver transplant. To prevent rejection of these transplants, they have to use medicines like steroids at least for some time. So when steroids are used, the bones can become weaker, osteoporotic. So steroids, sometimes antacids also. I have seen a lot of patients taking on as usual routine. They take one antacid tablet every morning. You must have heard of tablets like PAN, D, these, that. It's not good to take unless they are needed. You should not be taking these tablets on a regular basis because they also can weaken your bones. So if it is a need, you use them. If you don't have a need, don't go on taking it as a habit every day in anti-acidity tablet. That's not good. Similarly, other drugs also, like somebody has fits, for example, doctors will prescribe a medication to control the fits. We call them as anti-epileptics. They are also not good for the health of the bones. But fits we have to control, there is no other go. So doctors have to keep them on those medicines, in which case you have to take extra care to compensate that by observing the other measures which will maintain the health of the bones. So you have to consult the doctor, your own doctor or the orthopedic surgeon. They will definitely suggest measures how you can protect your bones in such a situation where you can't avoid taking such medicines. So that is as far as the medicines is concerned. And of course, diet also, as I already said, if somebody is not taking a balanced diet on a regular basis, they also can become osteoporotic. That means they can have brittle bones at a later stage. So it is very important to follow all these and implement them. Most important, I must again say, physical activity. Very, very important. Without proper physical activity, your bones can never be strong. So all must keep that in mind. Some sort of physical activity all through the life we have to maintain, and particularly in the case of children and young adults, this is very, very, very important. So then coming to joints. Joints also, healthy joints are very important for our mobility. Healthy joints in the sense they should not be painful. The full range of mobility, whatever is given by nature, need to be there, and of course the alignment and other aspects what we call, then only joints will function well and you will be very happy with your mobility. Mobility is life. Without mobility there is no meaning. So you need to have healthy joints, particularly the lower limb joints. We call them as weight bearing joints. Hip and knee, for example, very important for our weight bearing and for our mobility. Whereas joints of the upper limbs like shoulder, elbow, wrist, they are important for function, other functions of the body. So both ways, weight bearing joints and joints which are very important for routine functions of our any individual are very important. So we have to keep them healthy. Most importantly, these joints can become disabled. Normally we see accidents, injuries. If a bone breaks somewhere here, once the bone is set, either by the doctor or whatever, almost you will regain the function 100%. Whereas if the bone breaks nearer or into the joint, either this, the joint function is likely to be lost. So never neglect a fracture which involves any of the major joints. It needs to be attended by a proper doctor, properly managed. Most of the times they need surgical interventions. Surgery is required to keep the bones back and also to get the joint into a proper plane so that mobility is restored with physiotherapy measures. If that is ignored, the joint function can be lost. And second thing I must say, the simple thing, keeping the injuries aside, for the function of the joint, regular function of the joint, mobility is very, very important. The joint ends, two bones form the joint. Two bones. Say for example, at the knee you have thigh bone and you have leg bone. Both of them together form the joint. A bone and bone directly they don't come in contact ever. They are separated by what is called cartilage. In Telugu they call it as mrudulasti. This cartilage is like a cushion. This is very, very important. A thick cartilaginous layer will cover like a cap. For this, a cap like this. So in the joint, this cushion will sit on this cushion. That's why the motion is so smooth and also without any sound. That cartilage is responsible. That cushion like thing is responsible for the smooth functioning of the joint. There won't be any pain, there won't be any sounds also. And smooth movement will be there. This cartilage is very important. But remember, this cartilage, health is maintained. See, any structure in the any living structure in the body needs a regular supply of oxygen, nutrients, which is done usually by the blood. Here in the case of cartilage, this cushion, bones are supplied richly with blood. So they can remain healthy with nutrients that are supplied to them by blood. This cartilage doesn't have any blood supply. So how it is going to remain healthy? It gets its nourishment from the lubricant within the joint. The fluid that lubricates the joint is called synovial fluid. There is a membrane lining the joint, a smooth membrane which secretes this fluid, small quantity. For example, if you take the knee joint, such a big joint, you have the synovial fluid to the extent of about 1 ml or so, not much. Very little quantity will be there. This lubricates the joint. This also supplies the nutrients and the required vital things for the survival of the cartilage. So the synovial fluid that is there as a lubricant within the joint, any given joint, is responsible for the nourishment of the cushion also. So now you can imagine how important it is for the lubricant to circulate all around to maintain the health of the cartilage. That's why the circulation happens only when you keep your joints moving. So on a regular basis, we should be able to move the joints. It is a good practice if one can develop every day in the morning and evening to mobilize all the joints. Say for example, shoulder, I must say, rotating the shoulder 10 to 15 times forwards, backwards. That keeps the range of motion. And this particular motion is very, of course, in day-to-day activities, we will be keeping these joints mobile. Even those in the elderly age, for example, they will not have much physical activity. Such people need to mobilize the joints to keep this cartilage healthy. So mobility is very, very important for the health of the joints. And of course, as I said, other sorts of examples. One must also understand the muscles. The muscles are also very important for the functioning of the joints. The muscles which activate the joints, the muscles also protect the joints. They activate. Say for example, if I want to do this particular movement, muscles need to contract. So muscles must be strong and they should be able to move the joint. Apart from moving the joints, the muscle also will protect the joint. Without proper muscles, the joint will not be protected. In day-to-day activities, the joints will be subjected to so much of stress unless the joints are stable in a particular position. Without that, the joint is likely to wear out. This cartilage gets shed off. So slowly the cushion gets eroded and ultimately the bones will get exposed. That is what we call arthritis. This happens over a period of time, gradually, just like our motor car tires. Once you buy a motor car, new motor car, initially 2-3 years there won't be any problem. There will be some wear and tear taking place, but it won't be seen. The effect is not seen until a critical stage is reached. Similarly, this lining cartilage also, which lines the bones of the joint, gets worn out. The moment we start walking, there will be some wear, but this wear will not be noticed by the individuals until a critical level is reached. So this usually happens around the age of say 50 or something like that. The cushion starts wearing off slowly, layer by layer, layer by layer. By the time one reaches the age of 50, 60, the cartilage cushion is worn out, and then probably the raw bone is exposed and the bone over the bone will touch and they produce sound, pain and all that. Sometimes it will get swollen, sometimes even deformity, what we call bending of the joints also can happen because of the unequal wear. So this is what is called wear process. This wear again is a fallout of our activities. As I said, activity is very important for life. Various activities every day we have to perform. I also said that mobility is important, activity is important, sports are important, all of them will produce some sort of wear. In spite of that, we have to maintain all that. That is life. Then how to minimize this wear, and what is this wear? How does it influence the body? Wear, as I said, from day one there will be some amount of wear. I told you an analogy, motor car tire. The moment you start driving your new car, the tire starts wearing out, but it won't be noticed until certain, say for 2 years or 3 years, there won't be any effect. After 3 years or so, your car tire starts puncturing, and then you will realize that the car has worn out and you will go to replacement. Similarly, in any individual human body, this wear is going to start from day one. But why people don't have any problem until that age is reached? This is because the regenerative capacity of the body. The regenerative capacity. In simple terms, repair, you can say repair. So this repairing ability is very great in children and young adults. So on one side, because of your physical activity, you are wearing out this cartilage or whatever. On the other side, repair also will be taking place, because you have that much of potential at a young age. As a child, as a young adult, the reparative capacity, natural repair capacity of the body is so much, this wear is eliminated. The moment there is some wear is there, the next moment new layers are formed. So you won't see any difference at all up to certain age. And let us say, take an individual who is 50 or 60. There also the wear is going to be there, even though the physical activity comes down. See, at that age, people may not be as active as a 20 years old, but still the wear is going to be there and its influence is going to be there. How? This is because on one side you are wearing out whatever little physical activity you are carrying out at that particular, say 60, 65, wear is there, but your body is not in a position to repair that. The repairing capacity, as we have seen in the young individuals, will not be there to that extent in an elderly person who is, say, for example, 60, 70. That's why whatever damage has taken place, it is going to be there. The repair is not going to take place. That's why you see more and more of wear. That is what we call arthritis, age-related arthritis. We don't see arthritis in a young individual. Of course, there are other types of arthritis, for example, rheumatism. That can happen in younger individuals also. But this age-related wear and tear process is called osteoarthritis, and this is a problem of elderly people because of the constant wear that is taking place, and the body is not able to repair that. As simple as that. In a young individual, in a child, we never see osteoarthritis unless their joint is damaged because of some injury and that cartilage layer is damaged in the accident. Then of course they can also get osteoarthritis. That is what is called post-traumatic arthritis. Otherwise, age-related osteoarthritis we will never see in a young individuals, elderly people. So by the time they become 60, 70 or 75, they will have problems in the weight-bearing joints. This arthritis also is more in weight-bearing joints like knees. In our country, knee involvement is more than the hip joints. And a lot of times they see the doctors because they have painful joints, their mobility will be affected. Even day-to-day activities at home also they will not be able to perform because of the damage that takes place in the joints. So at that time, if it is in the early stages, by giving some medication, some exercise program and avoidance of certain activities, they will be able to manage. Their pain will come down and their function will improve. But if the arthritis and wearing process has gone beyond a level, then any of these measures are not going to be of any benefit, in which case we suggest them to undergo joint replacement surgeries. Joint replacement, some of you must be already knowing about it. Here what we do is we shave it off with special machines. We shave it off like layer by layer, all the damaged parts, and replace with artificial liners. We will there is a special glue, bone cement, that will be used to attach these layers to the prepared bone. That is a new joint again. New bearing surfaces will be added to the bones. So again you have a new joint which can last for a period of 20 to 30 years. That means if somebody undergoes a joint replacement at the age of say 65, 70, rest of the life, until their life, they will be able to enjoy a pain-free joints. I won't say 100%, majority of the times the joints replacements are very good. 98% success rate will be there, provided if it is done in a properly equipped hospital and well-trained doctors, 98% success rate will be there, and one can expect up to 95% pain relief after the joint replacement. People come and say, oh doctor, one of my neighbors underwent this operation and he is not at all happy, she is not at all happy. No, such things can happen once in a while. If 100 people undergo these joint replacements, out of 100, 1 or 2 may get complications like infection, wound breakdown, or sometimes dislocation, instability, such things. 2 to 3% I can say, but 97, 98% of them will enjoy definitely, and they will see the benefits of this operation. But I must say, all people do not require joint replacements only when it reaches beyond certain stage and there is nothing else that helps them. That is the stage when they have to think of undergoing joint replacements. Then a few words about diet. Also, already we have spoken about what sort of diet is good for bones and joints. I told. If you want, I can repeat. Calcium, regular supply of calcium is important. Regular supply of vitamin D is very important, and of course protein, and of course vitamin C also is important. Vitamin C normally is supplied in a natural way through citrus fruits like oranges, lemons. They are very good source of vitamin C, even guava, fruits like guava. But you can also have supplements in the form of a tablet, a chewable tablet once a day, and it's very safe, no side effects whatsoever. Even if you consume more, excess vitamin C will be eliminated through urine. And vitamin C is very important for our teeth, bones, and also the joint stabilizing structures like ligaments and other things. So some vitamins, regular supply of vitamins also is very important. That is about diet. So coming to the medication itself, when suppose not able to take a balanced diet or neglected for some reason or other, and when you go to a doctor and they will say, oh, your bones are weak, your bones are not healthy, then what to do? The doctor will prescribe these supplements, and the supplements will be usually in the form of, as I already said, calcium tablets, vitamin D, and sometimes even vitamin C. So vitamin D, usually it can be supplied in the form of a tablet or capsule. Nowadays it is is once a week is enough. Like that for about 8 weeks. After that, once in a month indefinitely one can take, because as I said, we are nowadays not getting exposed to the sun, and most of the diets, they cannot give you any vitamin D. Calcium, regarding calcium, the diets which are rich in calcium are dairy products. If somebody is taking dairy products on a regular basis like milk, yogurt, cheese, they supply good amount of calcium. If you are taking enough amounts of these dairy products on a regular basis, you don't need to take any calcium in the form of tablets or any tonics. Suppose if you are not taking enough dairy products on a regular basis, it is always better to take calcium supplements. We need calcium on a regular basis. If you don't take, your bones are likely to become weak. So you just judge yourself how much of dairy products you are consuming every day. If you think that you are taking enough, you don't need to take any calcium. If you are not taking enough dairy products, better take 1 calcium tablet a day. Of course, though, for non-vegetarians, I must say, fish along with their bones, sardines, salmons, everything, they are very good because they contain calcium, they contain vitamin D as well. But for vegetarians, you can depend on green leaves to some extent, green leaves and dairy products. They are very good as a source of calcium. And vitamin D, I already said, if possible for you, expose yourself to sun every day at least for half an hour. And if it is not possible, go for supplements. So that is about dietary products, and avoid alcohol, at least moderate. Don't take too much of alcohol on a regular basis. And smoking is bad, as I already said. Avoid smoking. So to sum up, I must say, for healthy bones, joints, avoid accidents, injuries, protect yourself, particularly elderly people, I must say. This is a very common problem for elderly people. Apart from the bones being brittle, they are likely to fall also because of so many reasons. I must say, for example, their vision will not be that good, and their stability, like neurological problems, they will be unsteady, gait will be unsteady. And particularly when they visit bathrooms, unfortunately our Indian bathrooms are always wet. Wet surfaces are slippery. They can easily fall and sustain a major fracture. Unfortunately, these victims, elderly people with hip fractures, they need a surgery. Surgery is a must for them. I must say 99% of them, they have to undergo a surgery if they have to be upright and mobile again, and a major surgery will be required, and any major surgery in that age will be associated with some amount of risk to life also. So anesthesia and a major surgery, you can avoid that by preventing falls in that age. So others in the family, if you have an elder person in your family, you have to pay some attention to these elderly people. See that where they live, to have some decent light, particularly at night. If they say, for example, to empty their bladder, if they have to go to the bathroom in the night, if adequate light is not there, in the darkness they can slip and fall. That can be easily avoided by providing some light, some bedroom light at least. Similarly, as I said, never keep the bathrooms wet, keep them dry. And thirdly, for those who need to visit the bathrooms very regularly, for example, a male with prostatic disease, I must say prostate, if anybody is suffering from, they need to go to the toilet every 2 hours. Similarly, diabetics, they need to go to toilet very often. How difficult it is for them to visit the toilet, and they can fall and sustain a major fracture. This can be avoided by providing the urinals for them, some commodes in the night particularly. They must be prevented to go to the toilet. So just give them a commode, ask them to empty their bladder into the commode, and next morning somebody can throw it out into the discard. So in that way, taking certain measures, and also wherever they live, elderly people in their bedroom or living room, whatever, don't keep any obstacles on the floor. A small, say, a toy left by the child, playing child, is enough for the elderly to stumble on it and fall onto the ground with a fracture of the hip. See, imagine how difficult it is after a fracture for that particular aged individual. A major fracture, major surgery under anesthesia, not only the amount of stress that undergoes the entire family because of that, the financial implications also. Nowadays, if a hip fracture needs to be properly treated, it will cost anything around 2 to 3 lakhs of rupees. So prevention is the best thing. By following simple measures, and as I said, if suppose their vision is not that good, visit an ophthalmologist and rectify the visual problems. Similarly, if any neurological problems is there, Parkinsonism for example, their gait will be unsteady, and by visiting a neurophysician they will prescribe medication which can be improved, or Parkinsonism condition can be improved. Similarly, if somebody has arthritic joints, knees which are worn out, because of that they fall and sustain a hip fracture. So at the right time, consult the appropriate doctor and take some rectifying measures so that you can avoid all those undesirable incidents happening for elderly people. So I think, so to sum up, I must say, for healthy bones and joints, please remember physical activity is the most important thing. Physical activity at any age, starting from childhood to elderly person. Elderly persons, at least they must be able to walk a little bit, even if it is with the help of walking aids. A little bit of walking on a regular basis definitely will keep the bones healthy. And if they can do some exercise in bed, what we call in bed exercises, they don't need to get out of the bed. Sitting in the bed, lying down in the bed also, they can do some exercises. On the other hand, for younger people, encourage them to play outdoors, outdoor activity, encourage outdoor activity, and encourage them to participate in sports and games if it is possible. If such things is not accessible or available, at least they can be allowed to walk around. Running is a good exercise, jogging is a good exercise, and impact, what we call impact exercise, very important for the strength of the bones. So always encourage younger people, children particularly, to have as much physical activity as possible. Provide them balanced diet. All this junk food is not good, I must say. Once in a while it is okay, children enjoy those. Going to all these, I should not name them, but all that junk food is not good on a regular basis. And one more thing I would like to say here, drinks, carbonated drinks are not at all good. Coffee, too much of coffee, too much of tea, too much of carbonated drinks, all of them will interfere with absorption of calcium, I must say. And if you don't have enough calcium supplied, even if you are taking it, it will be eliminated along with these useless drinks. Once in a while I also enjoy, but not on a regular basis. So coffee, tea, too much of alcohol, carbonated drinks, better to curtail that to have healthy bones and joints. So I think I have given enough information which at least to some extent will be useful for you. Please keep this in mind and try to counsel your family members, friends, whoever, to have healthy bones and joints.